Good morning everyone, we are group number 4 and today we will be discussing about the topic motion analysis and vertical jump. In this report, background, usage, importance, advantages and disadvantages of motion analysis will be discussed. Also, kinematic and kinetic analysis and the internal and external factors of vertical jump will also be included in the discussion. So, let us first define motion analysis. What is motion analysis? Motion analysis is a technique and it is often used by professionals with great experience and practice. It is able to measure movements and more specifically, detailed movements of a person and even objects. But this technique is more commonly used in humans to analyze their body movements more accurately and easily. Since we all know that manual measurement and assessment is 2 times harder and less accurate than using a device because we can have human error while analyzing it manually. Next, in motion analysis, it involves the usage of computer software, high-skilled cameras, and skilled technicians. The professional is going to connect the motion capture device or even the cameras, and after that, it can now easily track and detect the movements produced by the subject. After capturing, a software will be downloaded and results about the analysis will be produced immediately. Lastly, a lot of people think that motion analysis is only used in medical fields, but they are mistaken, since motion analysis has a wide scope and it is also used and seen in a lot of fields like manufacturing, video surveillance, biological sciences, and in medical field. Motion analysis in physical therapy. We all know physical therapists are known as movement experts, and by that, their job is to analyze and assess the movements produced by their patient's body, muscles, and even joints. Motion analysis is important in the field of rehabilitation so that they can capture detailed movements of their patients in a more easier, convenient, and accurate way. They can analyze the results step by step and details by detail. Because of the accurate results produced by motion analysis, it can now help physical therapists easily and properly plan exercises for their patient in order to give them optimal strength and for them to resume to their normal activities.
What is a squat jump? The squat jump is an explosive and more intense version of the squat. Also, the squat jump is a type of vertical jump wherein the moment from the upper extremity is restrained. And for this reason, the loss of force from the upper extremity makes the load and task of the lower extremity larger, and thus requiring more force from the lower extremity. That is why this type of exercise is usually done by athletes who want to put more work in their lower extremity.
The squat jump is a variation of a vertical jump. Another variation of this jump is the counter movement vertical jump. The squat jump starts from a semi-squatted position, then vigorously extends the knees and hips to jump off vertically off the ground. It does not have a preliminary down phase or counter movement, meaning that there is no stretch shorten cycle, in which the muscles undergo a sudden eccentric lengthening followed by a rapid concentric shortening. The phases of the squat jump include the crouch phase, followed by the push-up phase, the flight phase, and the landing phase. The crouch phase is a transition from standing posture to the maximum flexion of the knee and hip joints, which was not seen in the video. However, he begins the next phase, which is the push-up phase, as he squats down, leaning forward and swings his arms back. Next, the push-up phase, which is exhibited by the extension of the knee and hip until the body takes off. Here, the subject pauses a bit before swinging his arms upward toward the ceiling as he pushes off the ground and jumps off, extending the hips and knees as he does so. Additionally, the ankles also plantar flex. The flight phase which follows is the interval between the takeoff and landing when the body is in the air. Lastly, the landing phase is exhibited once the subject has made contact with the ground surface. Here, the tips of the toes are first to make contact with the ground, followed by the heel.
In this portion of the report, we will be discussing the overall movement of the body segments during the vertical jump and the muscles contracting during each phase of the motion. For the kinematic analysis of the vertical jump, knee extensors perform both concentric and eccentric contraction during jumping up and landing. In the vertical jump, the knee extensors concentrically contract, bringing the knee to maximal extension in order to produce enough force to lift the body off the ground. The knee extensors eccentrically contract to decelerate the knee flexion during landing. Combined motion of the hip and knee contributes to the vertical jump. The combined motion of hip and knee extension during the vertical jump helps increase the force produced by the muscles to propel the body upwards. The motion of knee extension causes an elongation to the multi-jointed muscles that pass through the knee, which provides these muscles with the optimal length to produce maximal force during the motion. The tibialis posterior stabilizes the foot arcs during activities with increased loads. In the vertical jump, the arcs of the foot provide a lever for the body to propel itself, and it serves a function to bear weight absorbed by the foot during the landing phase. During activities which impart great load on the foot, such as jumping, the support of the arcs of the foot are no longer limited to the ligamentous structures, and muscles like the tibialis posterior contract to maintain the arc actively. Arm swinging also helps increase the height of the vertical jump. The arm swinging motion in the vertical jump produces a momentum that causes a slower shortening velocity of the hamstrings and gluteus muscles, which enables these muscles to produce greater force with a better force velocity relationship. We will discuss the movement of the body segments and the joints during each phase of the vertical jump. In the push-off phase, the shoulder moves from its initial position of slight extension into approximately 155 degrees of flexion. The hip begins at approximately 90 degrees of flexion and extends into the anatomic position. The knee extends from flexion into 10 degrees of extension, and the ankle begins at dorsiflexion and moves into approximately 40 degrees of plantar flexion. At the flight phase, there is little to no movement of the body segments as the body is in the air. In the landing phase, the shoulder moves from flexion into about 5 degrees of extension. The hip, from the anatomic position, flexes about 155 degrees. The knee moves from maximal extension into approximately 100 degrees of flexion, and the ankle moves into 10 degrees of dorsiflexion.
Before discussing the different muscle actions in a squat jump, we will first have a brief overview of the different phases that are present in a squat jump. So first off, we have the push-off phase, which represents the extension of the body until it takes off from the ground. It is made up by a combination of different movements such as shoulder flexion, hip and knee extension, and ankle plantar flexion. Second, we have the flight phase, represents the interval between takeoff and landing when the body is in the air. There is little to no muscle activity in the flight phase since the body is stable and upright in a full extended position and its center of gravity is relatively near the base of support. Lastly, we have the landing phase, which represents the part when the foot comes into contact with the ground surface. In this phase, muscles eccentrically contract to counteract the gravity and body's downward momentum. Now we will discuss the different muscle contractions in each phase and joint during the squat jump. First, we have the concentric shoulder flexion during the push-off phase. By producing its own momentum, arm swinging lessens the negative momentum of the whole body, making it easier for the body to achieve a greater vertical velocity. Next, we have the powerful hip and knee extensors, which produce great force that is needed in closed kinematic chain motions, such as jumping, and to prevent the knee from collapsing in walking. Knee extension with hip extension is a common combination of hip and knee motions for torque production during daily living activities. This is the most useful combination that occurs in activities such as jumping to propel the body forward or upward. This positioning of knee extension, usually by contraction of
of the quadriceps allows the hamstrings to elongate over the knee and act as knee-hip extensors. According to Fleming, the hip extensors contribute the largest mechanical work towards vertical jumps, hinting to the strength of the large gluteus maximus. Next, we have in the ankle joint the concentric contraction of the triceps serrae, plantar flexing the ankle while the quadriceps extend the knee. As the quads extend the knee when starting the jump, the gastrocnemius becomes elongated over the knee, and optimal conditions result for plantar flexion of the ankle. This functional combination is again seen in the vertical jump among many others. Once again, the synergistic relationship between muscles provide for optimal sufficiency to permit functional motion to occur most efficiently. Next, during the flight phase, there is little to no muscle activity except in the shoulders, where the shoulder flexors eccentrically contract to prevent the arms from falling down mid-air. There's also little muscle activity since the body, which is in an upright extended position, has its center of gravity is in the middle of the body, anterior to the second sacral vertebra. Lastly, during the landing phase, the muscles eccentrically contract to counteract the body's downward momentum, which is caused by gravity.
To summarize, the internal forces in vertical jump movement comes from shoulder flexion, hip extension, knee extension, and ankle plantar flexion, whereas the body in this movement counteracts the external force of gravity.
Other factors that may contribute to a higher vertical jump. First is genetics. The only thing that we can do since it is out of our control is to ensure a healthy diet to keep our body fat percentage low. For the jumping form, when it comes to working out, quality is more important than quantity. A proper jumping form can boost your performance, it can conserve energy, and most importantly, it can reduce the likelihood of injury. The better the form, the higher the jump. Maximal muscular strength. In order to achieve a higher vertical jump, we need to strengthen the muscles that are being activated. This is where we do some exercises like squats, powerlifting squats, box squats, and deadlifts. Power. This is commonly mistaken as strength. This refers to the ability to apply force throughout the full range of body joint movement with speed for maximum time or distance. A higher jump requires a lot of force in a fraction of a second. Flexibility. If you're not flexible enough, you won't be able to get into the right position and go into the full range of motion when you jump. You can increase your flexibility by doing some proper stretching. Reactive strength or plyometric strength is the ability to switch rapidly. If you have difficulty in switching from the yielding eccentric point to overcoming the concentric point in the jump, you will have a hard time in executing the jump strongly and consequently. Effects of hip and knee flexion prior to jumping. You should know how much you need to bend your knees and hips before and after jumping. The more you bend, the easier it is for you to jump higher because there is a momentum when you bend your knees together with your hips. Effects of arm swing prior to jumping. Swinging your arms can also increase the height of a jump, where in Tagalog we call it as vuelo, before taking off the ground. That's why swinging your arms is one of the most important things to do when jumping. These are the main muscles that is being activated when doing a vertical jump. Quadriceps, glutes, hamstrings, and calf muscles. But take note, it is not just the lower body muscles that do all the work.
So, reflecting from the results, how will this help physical therapists provide better patient or clinic care? And what are the ups and downs of using motion analysis in general? First, we can identify the muscle groups recruited in the action, specifically the knee extensors, hip extensors, hip adductors, plantar flexors, and also the shoulder flexors. Additionally, we can determine if there is active or passive insufficiency, which can limit the action. Second, we can determine if there is a limitation in the range of motion in the lower extremity or in the arm. We can do this by manually using a goniometer or using a motion analysis computer software. Third, this can help us reveal pathological conditions or injuries such as osteoarthritis, hamstring strain, meniscal lesions, bursitis, nerve impingements, and many more. Fourth, proper body mechanics will be instilled, unlike the man in the picture below in which his knees were put together or in a valgum position. This hazardous position may lead to unwanted injuries. Fifth, we can evaluate joint motion characteristics obtained from human motion measurements, which can be applied in assistive technology. This is important in the making of prosthetics and orthotics for patients. And lastly, we can optimize athletic performance, which is essential in sports science, so they would be able to perform better and avoid getting common sports injuries.
Now, what are the advantages of the use of motion analysis? Using motion analysis is definitely more precise than manually assessing body movements using the human eye. Since it is a computer software, it is capable of providing detailed and precise assessments. Motion analysis makes use of cameras to capture the movement sequence. Thus, the sequence can be used multiple times instead of requesting the patient to repeat the motion. In addition, it also has capabilities in measuring triaxial data for 3D analysis through the use of small sensors on the patient's body, wherein the active role of the patient can be monitored as well. And since this is a computer software, it requires little monitoring from its users. However, there are also some disadvantages when it comes to using this software, one of those being a limited duration of battery. Several complications may come up as well through the usage of the motion analysis. It requires equipment and special setup dependent on environmental factors such as proper lighting, as well as having an adequate view of the patient in terms of distance and angle. The small sensors mentioned earlier could also cause discomfort to the patient since these need to be placed on their body. Furthermore, the data being measured could be interrupted due to skin movement over the body segments. Another disadvantage would be its dependence on how fast the movement is. The accuracy of the analysis could decrease if the movement has a higher acceleration. This is because the faster the movement is, the faster sampling rate is required. It also gives a long, detailed analysis that requires more time for study and interpretation. And lastly, as a tool in the physical therapy practice, it is quite limited in addressing clinical problems.